So when checking into the quads, you're usually going to be checking the quads when somebody has more of a knee complaint. Obviously, if they have a specific quad complaint, you check it. Often quads, you're checking for a knee complaint. So you're going to zero in on them for that reason, because you need to know the soft tissues that would end up moving the knee, what may or may not be going on with them. The other reason that you're going to check the quads from time to time is when the hip isn't responding. Or funny enough, when hip flexion or flexion of the femur isn't coming around. You've worked the hip, you've worked the hamstrings, it's just not changing. So sometimes if you use a straight leg raise as a test, and you do everything to the hamstrings and you work the hip and it doesn't work, sometimes you work on the quad and it changes. It's very, very confusing, very weird. But anyways, checking the soft tissue of the quad, for the most part, when you're checking a soft tissue, if you have it in a relatively shortened position, you're going to be able to test it better. Quads, you want to work perpendicular fiber direction. You do not want yield to pressure because it's exceptionally uncomfortable for almost everybody. So in this case, if I have a still femur and a moving muscle, so still bone moving muscle, I can do this, but because the knee's bent and this is relatively lengthened, I'm going to have a harder time. So simply, if I was to check it here, so in this case, just immediately as I lift, there's some strange resistance. I don't know 100% why. Are you comfortable enough?
Yeah, it's just coming from my hip.
Oh, sweet. Okay, so yeah, let that drop if you can. There you go. That better?
Yeah.
Okay. So positionally, he's showing some resistance, so I want to change it, make him feel a little bit more comfortable. Stabilize this. So hold the shin to stabilize the femur, relatively speaking, because if I'm doing this, I'm just going to roll his leg, right? So hold here, right? So push better, pull not so good. Everybody sees that, right? Move up higher. We get the nice kind of jumpy, right? So here, that's the resistance. Here it will move, and it's this side. So it's switched in a very short order. You agree with the sensation, right? So it's like, okay, that's restricted, that's restricted. I walk up a little higher. This side's good. This side needs the attention, right? I'm not going to go any higher. I don't need those problems. We'll have you on your back. So I'm going to roll around to the other side of the table. And when I do this, I don't know how many watch Futurama. I feel like Dr. Zoidberg. Now, in the case of the quads in supine, you benefit from being seated because pushing perpendicular to fiber direction works better here. Here, I have a harder time. This is harder. And also, I'm going to be tempted to just lean into it. Now, if I lean into it, that doesn't feel nice, does it? Right? It just doesn't feel nice. So osteopathic treatment, the barrier concept, even with assessment, you're attempting to avoid generating a need for protective mechanisms. Don't make them say ouch. So we know that the quads happen to be sensitive for most people when you push into them. When you move across them, not so bad. This is the other leg, so it should be a slightly different finding. Now, generally, I'm going to get some pressure on to the tibia and the fibula or the shin, and I'm going to hold in this position. So if it's out here, because of just the fact that it's tissue, it has some weight, it's probably going to want to just fall, right? So I straighten it up a little bit, right? So I create some rotation, and then I stabilize the femur by holding here. Now, push, pull, right? So again, this is okay. There's resistance there, right? Now as I walk up, now again, it's on this side immediately. So you're doing something very specifically for your vastus medialis, I assume.
Yeah.
You're purposely working your vastus medialis. Okay. Now, the only reason I can say that, you can't say that often with a lot of structures, but vastus medialis is very visible. It's very notable. The classic active rehab for knees is you try to strengthen the VMO, the vastus medialis oblique. Doesn't do what they think it does with respect to active rehab, but it does strengthen knee extension. So he's purposely working this, and the reason I can say that is because it's a very visible thing. It's the only thing that's there as far as muscles. So that's one of the muscles that you can probably pick out. But yeah, just push, pull, right? Now in lateral, I'm not going to show it in lateral. The challenge with lateral that you all probably figured out is that when you're there, because they're laying on their side, there's tension, it's harder to straighten the leg out. And you can really only meaningfully push down. It becomes easy, but pulling up is hard because you're going to start to try, you're going to lift their leg a little bit. It's going to get weird. Now, the one thing that I will note in supine, so this is relatively shortened. Interestingly, these fibers are relatively lengthened, right? So sometimes when checking the full range of the quadriceps, right? So here, like I can do it, but if I need to get up any higher, just because of my hand's going to go to midline, I'm not going to be able to get a good grip. Also, this tissue is going to tend to be in a relative lengthened position. So if I do this, right, I can still check this stuff. Obviously, this is now more tense, so it's a bad place to check it. But the moment I get up here-ish, right, I get a similar finding to what I had before. Now when I get up here, I can check it, right? And I can even come through here. So I can get up into that high, like rec fem-ish, sartorius-ish stuff, right? I can get in there because I can wrap around it better now. So my hand becomes, the space that my hand is spanning becomes smaller, and I'm not going to midline now. So I can check it better. I can check the high quad better with a flexed hip, right? So let's just say in lateral, maybe you can do this okay, but because you're in lateral and leg is over top of leg, it gets a little creepy. So stay away from that. Just be very careful in the region of the pelvis when your hand starts to go to midline for any hold. Try to obscure the midline to the best of your ability. So this allows you to actually check the high quad better because it's relatively shortened now. Now it's relatively lengthened. So for the full length of the quad, you actually benefit from two separate positions of the femur in relation to the torso.